13th House Common Standing Committee on Veterans Affairs. Pursuant to Standing Order 108-2, the motion adopted by the committee on October 27th, 2020, the committee is beginning its study on supports and services to veterans, caregivers, and families. Welcome to all of the witnesses who have taken time to join us today. From the Department of Veterans Affairs, Mr. Stephen Harris, Assistant Deputy Minister, Service Delivery, Mitch Freeman, Director General, Services Delivery and Program Management, Crystal Garrett Baird, Director General, Policy and Research. Also from the Office of Veterans Ombudsman, we have Colonel Jardine, Veterans Ombudsman, and joining the Colonel is Dwayne Shippers, Strategic Review and Analysis, Director and Legal Advisory. Welcome to all of you, and thank you so much for your patience, and thank you for accommodating our sometimes very crazy schedule. Without further ado, I will turn it over to Mr. Harris, who will start off with his 5-minute opening remarks. And again, just a reminder, once Mr. Harris is finished, we will go into the first rounds of questions. And at about the halfway mark, we will switch over to Colonel Jardine. So Mr. Harris, the first 5 minutes are all yours.
Good afternoon, Mr. Chair, or good evening almost now, and members of the committee, thank you for the invitation to be with you today. Bonjour, Monsieur le Président, Mesdames, Messieurs les membres du comité.
Hello, Mr. Chair, ladies and gentlemen. I am happy to be here today.
COVID pandemic started in the Canadian context and greatly affected all of our daily lives. The effect has been felt by those we serve, our veterans and their families, members of the Canadian Armed Forces, and the RCMP, and by those in the department in how we are organized to deliver much needed programs and services. As I reflect back over the last year, I'm proud of the innovation, flexibility, and resilience of veterans and the organizations that are dedicated to supporting them. La pandémie étant toujours une situation prioritaire pour nous tous. Anciens combattants, Canada s'est adapté et continuera de le faire pour répondre aux besoins de nos.
Continue to adapt to support the needs of our veterans and their families.
Some of these changes, I wanted to take this opportunity to provide the committee with a brief update on the Wait Times Initiatives plan that was submitted to ACVA in June of 2020, and to thank the committee for their report, Clearing the Jam. Since the minister's last appearance in November, we have hired more than 350 additional staff from across the country to strengthen our capacity to make more and more timely decisions for veterans on their disability benefit applications. These staff are now trained and are making decisions, and this will be one way that we will reduce wait times for veterans. En outre, je tiens à souligner.
In addition, I would note that since March 23, 2020, the start of the pandemic, Veterans Affairs has issued nearly $1 billion in new disability benefits to veterans.
And services that contribute to the well-being of veterans and their families. We are making sure that these programs are available to the veterans who want and need them. Newer programs, like the Education and Training Benefit, provide veterans with funding for post-secondary education, training, or shorter courses like workshops or seminars, while Career Transition Services assist veterans by providing individualized support for job search skills and career counseling. Finally, the Veterans Emergency Fund is there to help when veterans are facing a financial crisis or emergency and are not available to veterans and are available to veterans whether they have a service-related disability or not. Faced with a prolonged pandemic environment, we know that our most vulnerable veterans are at risk, and so we've made more than 18,000 calls to check on them. We've reached out to connect with our case-managed veterans, those with health-related issues, those who live in remote areas, and those at risk of homelessness. We are currently reaching out to all of our women veterans. In all cases, we can use these opportunities to make adjustments to programs and services based on the needs of these veterans. Of course, COVID has had a significant impact on long-term care facilities. As VAC supports about 4,000 veterans in long-term care facilities across the country, we are working with long-term care homes and family members to make sure our veterans are safe. In some cases, we are ensuring that veterans have the supports they need if they want to bring their family member home. We've also been paying for personal protective equipment for veterans who receive face-to-face treatment, and we've waived the need for renewal prescriptions during the pandemic, and we've extended our telehealth coverage. Étant donné que la COVID
Recognizing that COVID-19 has had a negative financial impact on some veterans, we have changed our Veterans Emergency Fund to cover COVID-19 related costs and allowed for a maximum funding of $10,000. All these measures are in place to ensure veterans can continue to receive the help and support they need.
Examples of programs and services are important, but we also recognize the need to highlight the impact that mental health can have on our ability to take care of ourselves. That is why Veterans Affairs Canada offers a range of supports to mental health services for our veterans and their families. With access to over 12,000 mental health professionals across the country, the VAC Assistance Service, which is available 24/7 to veterans and their families, and with 11 operational stress injury clinics and satellite service sites, there are multiple ways to access support and treatment. In the COVID environment, many of these services can be provided virtually, allowing all veterans, even those who live in remote areas, to be able to continue to access safe support and treatment. Recognizing the critical role of families in supporting our veterans, Veterans Affairs provides a benefit to caregivers of veterans with serious disabilities and expanded the Veteran Family Program to 32 military family resource centers across Canada. This program is there to help veterans and their families transition to post-military life and connect them with community resources. There
is still much research to be done on mental health and post-traumatic stress disorder, PTSD. The Centre of Excellence on PTSD and Mental Health Conditions is funded by Veterans Affairs Canada and is doing some excellent research on the impact of COVID-19 on veterans' mental health, veteran family mental health, peer support, and types of treatment for PTSD, to name a few.
Veterans and their families are coming to us and finding services and supports they need. We continue to adjust as the new information becomes available. We continue
to adjust as new information becomes available. We have given our employees the tools and support to work from home so that they can support our veterans and their families. Together, we will work to positively impact the well-being of our veterans and their families.
Merci.
Thank you very much. And we're going to go, like I said, right into questions. And first up, we have MP Wagenthal for 6 minutes.
There we go. Thank you, Chair. And I do thank you, Mr. Harris, for your comments, and as well, Mr. Freeman and Ms. Garrett Baird for being here today. This is a really important issue to me in my communications with our veterans and their families. I hear over and over again, we were told when we signed up that we had no need to worry. Our families, our spouses, and our children would be a high priority within the armed forces and as veterans. However, I have to say today that I have some deep concerns that I'm relaying to you on behalf of especially spouses that I've communicated with, having had a town hall with the Caregivers Brigade recently discussing this very issue around the caregiver benefit. And one of the first comments was, it was changed to caregiver recognition benefit. But many of them feel that the recognition is still not there. And one of the main reasons is the focus is entirely on physical, visible injuries. And those that suffer with mental injuries may have physical as well, but they don't impact their ability to function the way their PTSD or operational stress injuries do. And they do not qualify as caregivers for this benefit. Do you not see that as a huge incongruency when we talk about taking care of veterans' families? Mr. Harris.
Thanks very much for the comment and for the feedback that you're receiving and the ongoing work to speak with veterans and their families. I think when we've made the transition from the family caregiver benefit to the caregiver recognition benefit, that was in response to input that we received from veterans, in fact. And so part of the challenge that it was in place before was that the FCRB, the previous benefit, went to the veteran instead of the actual caregiver. The change to the caregiver recognition benefit meant that the tax-free allowance that's associated with it went to.
Sir.
Sure.
I'm not arguing with how it's provided, because that's all very clear, but things on paper don't necessarily translate into the true needs of the spouses or of the caregivers. And in this case, because the focus is on physical injuries, I don't know who you spoke with, but there's this thinking that they can go out and do their yard work. That's good for them if they have mental health injuries. But these are people with serious issues that trigger them, that are involved in things like that, like the smell of gas or oil or backfires and the noise levels and this type of thing. And so the expectation is that they can function in ways that those who have physical disabilities can't, and yet it's not true. So I know that the Ombudsman has, since 2016, has indicated that this should be a change, that these caregivers should receive the same recognition that those do who are supplying that care that the Armed Forces and Veterans Affairs says they will to our veterans' families, but they don't qualify. What is your perspective on whether or not that should be readdressed? Because the impression that I get is definitely that this is a huge incongruency within the program.
I think that the answer to the question is that the caregiver recognition benefit was designed for the most seriously disabled veterans and to recognize the role of families or caregivers involved in supporting them.
What is the definition of most severely disabled? Is there a definition?
There isn't a particular definition, although I'll turn to my colleague Crystal in a moment to provide that back. It's assessed against a series of activities of daily living, which recognize the severity or the impact of either physical or mental health disabilities on the individual veteran, and as a result on the supports that are required from the caregiver. Crystal, I don't know if you wanted to add something in on that one.
Yes, thank you, Stephen, and thank you for the question. So as Mr. Harris indicated, the benefit is focused on those with the most serious service-related physical and or mental health disabilities. And when we look at the criteria as set out in the regulations, which we follow, there is reference, of course, to veterans being unable to carry out most activities of daily living, but other criteria that are set out there include individuals that would be institutionalized, be it hospitalized or in a care facility, if not for their caregiver. Another criteria is relates to
Ms. Garrett.
Yes.
Garrett, I appreciate what you're saying. I appreciate it. I do. But the truth of the matter is that there isn't an equal access to this caregiver benefit for those who have the mental challenges more than the physical. And the truth of the matter is they cannot function, many of them, on a day-to-day basis. They can put their pants on, they can have a shower on their own, but they need assistance to get to that point, or they cascade down so badly in response to something that they literally can't function at all. So it's up and down, it's constant. What I would like to hear is that there is a realization that in circumstances where an individual has physical disabilities, possibly, I would imagine that most of them would have some, but there's not a true focus on dealing with the mental health issues that caregivers have to deal with their spouses, and as a result, often suffer themselves, as do the children. So this benefit, it's been challenged many times. Can you not indicate that truly we need to take a far better look at how we implement this particular program? When you say most disabled, how do you define that?
We're actually over time, but I'll allow for a very brief answer, please.
Certainly. Look, we recognize that caregiving can be stressful and burdensome and can negatively impact the mental health and well-being of our caregivers. And when we look at the criteria, we are applying that to individuals with physical and mental health conditions. Thank you.
Thank you. MP Fillmore for 6 minutes, please.
Thank you, Chair, and thank you very much, Mr. Harrison.
Sorry, Andy, can you put
Yeah,
your
you got
volume
it.
down? There
Thank
you go.
you.
Thank you.
Thanks, Chair, and thanks very much, Mr. Harris, and to your team there for being with us tonight, and for all of your work. I wanted to sort of ask you about the Veteran Family Wellbeing Fund and the Veterans Emergency Fund and funds like them, and wondered if you could describe for committee members some of the success stories you've seen. What on the ground? And I was going to ask you for specific examples of organizations, but maybe we can avoid specific names and just really get to what the money is doing, how it's helping, and what are some of the successes that you've seen through that funding, and maybe some of the limitations that we should be looking at.
I think we may start. I'll ask Crystal to answer with respect to the Veterans and Family Wellbeing Fund, and we may come back on the Veterans Emergency Fund later.
Big thank you, Stephen, and thank you for the question. So the creation of the Veterans Family and Wellbeing Fund was announced as part of Budget 2017. And what it provides is $3 million annually in grants and contributions for organizations to conduct research and implement initiatives and projects that support the well-being of veterans and their families. So this fund has enabled us to have strong collaboration and support innovation. It's a strategic approach that really gives us capacity to find innovative ways to enhance our support to veteran health and well-being while preventing duplication and service and program delivery. So when we look right now, this fund is available to nonprofit charities, research and educational institutions, Indigenous organizations, and in some cases for-profit organizations if they meet the criteria. And the program is working, and we have some really, really good success stories, both for specifically for veterans, but also for family members and caregivers. And I can just touch quickly. There is one organization that has been a recipient, and what it is doing is supporting women veterans, soon-to-be veterans, and our spouses of veterans, where they gather to prepare for the next chapter of their lives, which is leaving the military. And the funding that's been provided to this organization has supported multiple workshops that's allowed these participants to map out their future and how they access services and to develop a network of mentors. So it's very much a collaborative approach. Another wonderful success story is related to veterans, where they're positively being impacted in the community and supporting survivors of disasters. This organization has exceeded every target set and went well beyond expectation, reaching a greater number of veterans because of their ability to provide meaningful opportunity to continue to serve communities and provide high quality training initiatives that upskill the abilities and skills of the veteran population. So through this group has been able to have deployment ready capacity to support disasters, increase the volunteer capacity, increase the number of veterans engaged as well, and really give veterans a sense of community and purpose to give back. I'll just touch on one final one as well, and it is related to an organization that works with grief experts, veterans, and their families to develop a series of online psychoeducative learning modules that are tailored to the unique grief experience of Canadian veterans, former RCMP members, and of course their families. And these modules, supported through the fund, assist veterans to understand and work through grief, stress, occupational stress, and the support for their families with that. We've had 43 projects that are part of the fund to date, many of them being very successful in supporting key populations such as our homeless veterans and of course our families and caregivers. We've recently completed a call as well for applications, and we're in the process of evaluating those to support even more organizations. Thank you.
Thanks for that. And Chair, if there's time, it would be nice to hear a little bit about the Veterans Emergency Fund, how it specifically lands on the ground and what programs it's helping.
You have just under a minute and a half.
Mitch, do you want to go ahead and answer that?
Certainly, thank you. And thank you, Mr. Chair, for that question. You know, what a wonderful question about the boots on the ground with respect to the Veterans Emergency Fund. And this fund is set up in order to deal with those unforeseen crisis situations that a veteran, a spouse, or their family may find themselves in. And so two real clear examples was, dead of winter, furnace is in distress, needs to be repaired. The veteran is not capable of fixing that with their own financial situation. And the Veterans Emergency Fund was able to deal with that situation, both repair that furnace and make sure that the family is looked after in the dead of winter in that particular regard. And another example would just be, going to that veteran who finds themselves needing shelter. We are able to put them up in a hotel while we then work with them to find other services, be it provided by Veterans Affairs, other provincial services, other community services in their particular region. Thank you very much.
Okay, thank you for that. And Chair, are we out of time there?
You have about 15 seconds. So.
Well, I'll thank you. I'll just take it to say, while we go through this evening and hear from you, I think the members of the committee would also like to hear where the challenges are. So while it's important to hear how the successes are going and where the programs are working, we'd also like to hear a little bit about where extra help or changes might be required. So I'll just leave that thought for the rest of the testimony.
Thank you. And up next, we have MP Desilets.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Hello. Thank you, all of our witnesses. I do have a question for you, Mr. Harris. It's a pleasure to see you again. It's a very simple question. Does your department feel supported by the Prime Minister, where your wishes are concerned for veterans? Thank you very much for the question, and I'm happy to see you again as well. What we're seeing in terms of priorities at the department to serve veterans and their families, well, it's a significant investment in terms of workforce and creating new programs and services that are there to better support veterans and their families. So I'll give you two examples. Of course, we've brought down waiting times for decisions for veterans. We're trying to improve waiting times. We've added additional human resources to help us out, and I can tell you that since the summer, we've hired 350 additional individuals to help us in our efforts. Second, we just talked about the emergency fund. Now we saw that there was something lacking. We needed to help veterans in a crisis situation. Some of them needed immediate financial help. And we created the Veterans Emergency Fund, which is there to offer help immediately when veterans need it. I've understood that very well. Thank you. If I ask you the question another way, in 2018, during a public meeting, the Prime Minister said in Edmonton very clearly that veterans are asking for more than we can give. That's what I'm getting at. Do you get the impression that we're giving enough to veterans, or do you feel like veterans are asking for too much, or that as a committee we're too demanding of veterans? I think that the answer to your question is that, well, I can't speak on behalf of the Prime Minister, but in terms of the department, I can tell you that we're working closely with organizations throughout the country to serve veterans on all fronts, not just for benefits and services that they need, but the organizations that are there to help them or to give them support during the pandemic. We're working closely with all veterans organizations to make sure that they can take more advantage of programs and services that are in place. All right. How much time do I have left, Mr. Chair? Okay, that's taking too long. Now, we're all very concerned because veterans often they live with post-traumatic stress. And in the news today, we were reminded of a nightmare from 2017 when Mr. Desmond killed all the members of his family. Well, 3 members of his family. And so this is fresh in our minds. And one can wonder if veterans are getting the help they need. And we all understand that we can't save everyone. We can't save the world. My next question is this. Given the importance and the urgency to respond to a post-traumatic stress situation, are the new directives in connection with mental health, well, there was some discontent. Some people weren't happy about this. Are there services for mental health for family members of veterans? How could I say this? Services have gone down. It's not easy to get to use those services. So I'd like to know what's the directive, and it would appear that there wasn't sufficient follow-up. Why not? I know that I have to answer very briefly. There are a lot of elements in your question, unfortunately. Very briefly, what I'll say is that there are supports that are in place to help out with family members' mental health, not only within programs that serve veterans, but within other initiatives in place. For example, the operational stress injury clinics and the services we offer over the phone to support family members. There's not only one way to access these supports for mental health. Now, for the calls that were made, were these courtesy calls that were made? No, these weren't courtesy calls. These were calls that were meant to find out how they were doing during the pandemic and find out if they needed further support and help. Thank you very much, Mr. Harris.
Thank you very much. Now over to MP Blaney for 6 minutes.
Thank you, Chair, and thank you to all the witnesses that are here today. It's always good to see you. I just wanted to follow up on what Ms. Wagenthal talked about as well, is the really important aspect of definitions. I think a lot of veterans and family members are confused about back services and benefits because of a lack of clarity around definitions. For example, caregiver and family. In some places, this topic is titled Caregivers and Family, implying that there are potentially 2 separate topic areas, but in other parts of the document, there is a reference specifically to family caregivers, implying that all caregivers are family members. And I hope BAC understands that's not the case. There's also other places that talk about spouses and then family as if they are meant to be interchangeable items. So I'm just wondering, first of all, could your office please send to the committee the definition, the official BAC definition of family and of caregiver? That's my first question. Can you do that?
First, Mr. Chair, if I might just ask, I'm not sure which document the committee member is referring to, but we'd be happy to share
the OVO report.
Okay.
Okay.
We'd be happy to share the information back on the definition of caregivers and family.
Okay, that
to
would
the committee
be.
member.
Thank you so much. So, can you be a non-family caregiver, for example, a roommate or a neighbor?
And this is a question specifically with respect to the caregiver recognition benefit or any other programs or services?
Any program that is about providing supports for caregivers. I think it's really important that we define what a caregiver is. Can a caregiver be a non-family caregiver, for example, a roommate or a neighbor?
Absolutely. The caregiver can be whoever is providing that care to the veteran And that's why, in part, the change was made to ensure that the payment was going to go to the caregiver who's involved. There are some definitions with respect to exactly who can be a caregiver with respect to age and other things, but it could be a non-family member, certainly.
Okay, so if you have a family member that doesn't live with a veteran, but maybe provides mental health support throughout the day, for example, a parent that lives in a different city that is still supporting their single but mentally challenged adult veteran, like somebody who's really struggling, can that person also be categorized as a caregiver?
Crystal, do you want to talk about the specifics of that?
Sure, and I believe that it will be beneficial as well when we send the formal definitions of caregiver and family members that will certainly assist. So as Mr. Harris indicated, when we changed the name of the benefit to recognize caregiver recognition benefit, it was done to ensure that we recognize those informal caregivers. So those are individuals that provide support. And of course, in looking at that, we do apply the criteria as set out in the regulations and what kind of supports are being provided by the caregiver to the veteran. So it's a case-by-case analysis based on the information that's presented.
Okay, so if it's a case-by-case analysis, how do you make sure there's consistency? How do veterans know if they're receiving the same supports as another veteran is, or the caregivers in this case?
And I think, if I may, part of what we do is a continual review of the program and the way in which it's applied, and set out criteria. You may be aware that recently our audit and evaluation area completed an evaluation of the caregiver recognition benefit, having to do with the regular review of new programs coming into effect. And they've made a number of recommendations having to do with ensuring that there's consistency in application in terms of the guidelines. We're working to respond to the recommendations that were made with respect to that particular evaluation. Which includes, I think what you're identifying here is to ensure that from coast to coast in individual circumstances, there's a consistent lens being applied to the decision making around it in terms of the assessment and ultimately the decision on the benefit itself.
Thank you. So I'm going back to the OVO report. It recommended that VAC, and I'm quoting, that VAC conduct and publish a gender-based analysis plus of the accessibility to mental health treatment benefits and services to family members, including spouses, former spouses, survivors, and dependent children, to determine if there are barriers which make it difficult for certain groups to access the mental health care that they need. Of course, I think that's a great recommendation. I'm just a little bit curious about why this is listed as a recommendation. Is VAC not mandated already to do a GBA plus analysis for all of these types of issues?
I think my first response to you is that you'll have to ask the ombudsperson herself as to why she decided to put it in or include it as a recommendation. With respect to our obligation to look at everything from a GBA plus lens, to look at it from all of those, we do that on a regular basis. Crystal, her policy team, Mitch and his service delivery team continue to look at the application of the way in which programs, all of them, not just the caregiver recognition benefit, are actually managed. Some of them are new, and we learn as we go forward through that, and we make adjustments from that period of time. Some of them are part of regular reviews, but we look at those kinds of things, and we are mandated to look at all of those things as we go forward with respect to the way in which the policy and the programs are run.
So can you tell me a bit, and I'm sure I'm going to have to follow up with this in the next section, but how is the GBA plus being implemented? What kind of training is happening? Who's getting the training?
Sure, I might ask Crystal if she wants to.
Very briefly, please, because that's
Thank you, Chair.
Sure, thank you. So there is training that's being provided within the department. We're also working quite closely with our colleagues at AWAGE who are supporting us with some training and some new tools. And just to Mr. Harris's point as well, as part of any new policy, program, or service, there is a GBA plus analysis done, and that's continuously reviewed and adjusted as our programs evolve. Thank you.
Thank you. And now for 5 minutes, MP Broussard, please.
Thank you, Mr. Chair. Good to see you again, Steve. In your briefing, you mentioned about 4,000 veterans in long-term care facilities across the country working to keep them safe. In the context of COVID, how many of those veterans and their families have been vaccinated against COVID-19?
I wouldn't have the specific figures to respond to the question as to how many of those veterans have been vaccinated at this point. As the committee member would be aware, The provincial government is in the midst of, provincial governments across the country are in the midst of deciding exactly how the vaccinations are being rolled out, although I am happy to report that long-term care facilities are priorities in almost every jurisdiction that I've seen. And we do know of a number of facilities across the country where vaccinations are well underway or actually completed for veterans.
Frankly, I'm kind of surprised that you wouldn't know those numbers, given the fact that they are under VAC care. And curiously, when I go through the National Advisory Committee on Immunization, not once in their plan are veterans mentioned. Yet, the Veterans Administration in the United States has taken the responsibility of vaccinating their veterans, particularly because of their elderly and the fact that they have comorbidities, which put them at greater risk. How come VAC didn't initiate through its own initiative a vaccination program for veterans in this country, and why is it not a priority in the Center for Immunization?
Thanks for the question. And I think the answer to the question is that the systems are actually quite different. The healthcare system in the States, in the US, as you've referred to with respect to veterans, the Veterans Administration actually runs the hospitals, it runs a lot of the facilities where veterans are being supported through long-term care facilities. That's not the case here. Where there's provincial jurisdiction and provincial healthcare regulations that are in place. We do, and Mitch's team, and I'll ask Mitch to chime in a second if you would like, we do regularly speak with all of the facilities, particularly where we have a significant population of veterans, but all of the other facilities where veterans are located to ensure that their care is being well supported and to see if there's anything else that we can do. Mitch, did you want to add something there?
Just briefly, Mitch, if you can, because I want to go in another direction here.
Certainly. Well, I would simply say that we are working very closely with all of the facilities of these 4,000 veterans on a day-to-day point of view, monitoring for vaccinations. It is certainly a priority of ours to make sure that they have everything that we can offer. And so we do monitor it very closely, and we're quite happy that long-term care facilities are at the top of the list and are being done first.
Thank you. I want to talk now, Steve, about Sean Brouillet. The Veterans Ombudsman came out with a report just before Christmas. And since we are talking about caregiver for allowances for veterans, you're probably aware of the case. The Veterans Ombudsman talked about it as being vengeful and retaliatory. The minister's office said that that decision was made by senior bureaucrats. My question to you is, why would Brouillet be cut off? And are there any other veterans in a similar situation to Brouillet whose benefits are continuing right now?
Thanks again for the question. As you would appreciate, we cannot speak to individual veteran situations with respect to the way in which benefits are administered. I'd be happy to take any questions with respect to general issues on a program that would be of interest to you.
So my question is then, why would his benefit be cut off when he had been receiving it? The minister said that it was the bureaucracy back that made that decision. Why would that be done?
I think in general, when we look at whether benefits are either in place or when they may be removed, they're applied against the context of the situation that they're found in. In other words, circumstances and situations could change for individual veterans, and their access and eligibility to veterans may also change as they go through a process of either rehabilitation, treatment, any number of other things. And so situations are reevaluated. People are able to access additional benefits. Some benefits do not become relevant for some individual veterans over time. And that may be a case where individual veterans find themselves in different circumstances as a result of either improvements, changes, which would have you. But I couldn't speak to an individual case in this instance.
My last question is: we're seeing broadly across society issues come up as a result of COVID. I would expect that caseloads are going to increase, particularly in the area of mental health. How prepared is the department to deal with what is anticipated to be an influx of even more cases?
Very, very quick answer, please.
And quickly on this, what I'd say is, there's a number of different ways in which we can approach and support veterans in mental health. Case management is one. The opportunity for veterans to participate through the occupational stress injury clinics is another. Over the course of the last year, the transition for the occupational stress injury clinics has been quite good to be able to move to that virtual support and platform quite quickly to continue to support people through a very difficult pandemic.
Thank you very much. And now for 5 minutes, MP Amos, please.
Thank you, Mr. Chair. Merci, Monsieur le Président. C'est fort apprécié. Et Madame.
It's very appreciated. I thank you, Mr. Harris and Madam Garrett Baird and Mr. Freeman. Thank you very much for your contributions and your presence today. I'd like to ask you a question about the military family resource centers. A few years ago, I believe it was already a few years ago, the government invested something like $700,000 to bolster the services offered by a number of centers. I believe there were about 30 of them. And I'd like to know how the money was invested. What improvements were made? Now, I'm not familiar with these centers. I don't know if there are differences between them. And so I'd like to know a little more about that. Thank you. Thank you for the question. I can start, and then I'll ask Mitch to add some more information. Now, when we talk about the family resource centers, well, it's a program for families with specific needs. That is, armed forces members who were released for medical reasons. So it's a program that supports them across the country. There are 32 resource centers for families, and they provide coordinators to support the veterans, but also their families during this transition period. So this means they can get connected in person on the base or by phone, which of course is more and more common during the pandemic, or online. There are support services available to them during their transition after their military service. The information line is available 24/7, and the coordinators can help them. They're designated to help them. The coordinators try to guide family members to resources as well in order to facilitate the transition.
He would add a little bit more about the Veteran Family Program, if that's okay.
Thank you, Stephen. I would simply add a bit more detail around the military family resource centers, noting that they are managed by a group of volunteers at a board of director level, and they look at the community resources and assess the local needs. And therefore, all of these 32 locations offer what is needed in their community. Things such as specialized transition programs around financial, education assistance, employment and relocation services. A program called COPE, Couples Overcoming PTSD Every Day. A program for care for the caregiver. Enhanced information and referral services. And as Mr. Harris noted, the family information line. And also training around mental health first aid. I would also highlight that in 1920, in the fiscal year 2019-2020, nearly 3,000 individuals accessed the Veterans Family Program that provided nearly 9,000 interactions with veterans, as Mr. Harris noted, medically released and their family. And so, as noted, 32 locations across the country. Veterans Affairs certainly provides funding for this program as managed by our colleagues at the Canadian Forces Morale and Welfare Services. Thank you.
Merci, Monsieur.
Thank you, Mr. Freeman and Mr. Harris, for those answers. I'd like to go back to this theme, but I now understand the type of program and services that are offered.
stop?
Yeah, if you've got a final comment, but you're out of time.
Well, I'll leave it there. Merci en tout cas.
Thank you, Will.
C'est fort apprécié.
Thank you. It's much appreciated.
Excuse me, MP Desilets for 2.5 minutes, please.
Merci, monsieur.
Thank you, Mr. Chair. Now, you referred earlier to 18,000 calls that were made. Was this done with an automated phone service, or were they actually individuals who were calling people? Yes, case managers and other people within the department were making the calls. Okay, that's interesting. And so are we to understand that recruitment of staff is going well, so there are fewer problems than there were a year ago? I think that the simple answer is that even during the pandemic, we were able to hire over 350 people. So this was an incredible effort made by the team or at the department. Very well. Another question. At the St. Anne Hospital, we have a special clinic that takes care of individuals who are suffering from operational stress-related injuries. In the context that we've been living in for the last year, has there been an increase or not in the budget earmarked for this? Because this clinic offers services to families. All the clinics of that type offer services to families, so it's not unique to the St. Anne clinic. They're found all throughout the country. They all offer services to families. And I can say that we are continually discussing with each of the clinics to make sure that they have what they need to give their services. So the budgets have been maintained. There wasn't an increase necessarily. Is that what you're saying? While I'm not aware of any changes to the budget, there definitely hasn't been a decrease. Okay, thank you very much, Mr. Harris.
Is it? Awesome, thank you. Over to MP Blaney for 2.5 minutes, please.
Thank you so much, Chair. So I'm going back to the OVO report again. The paper mentions in several places the government-funded operational stress injury social support program, and it's peer support program specific for spouses of operational stress injuries. Again, this is really talking about caregivers. Is this program also open to caregivers that are not spouses?
I'd have to come back on that one specifically. I'm not sure that it is open to caregivers, but it may be open to caregivers given that it's based on the recommendations of professionals who engage in a multidisciplinary approach for supporting the veteran. So I'd have to check exactly on the caregiver definition that you've brought here.
Okay, perfect.
But I do know they bring in a number of different people to be able to help support the veteran as part of the treatment.
Okay, so I also note that an operational stress injury is defined by the OSISS program as any persistent psychological difficulty resulting from operations in the military. Those operational duties can include training incidents, domestic operations, and international operations. Can you clarify if VAC does or does not consider persistent psychological difficulties resulting from military sexual trauma during operations an OSI or not? For example, can a spouse of an impacted military sexual trauma veteran call up OSISS for peer support or not?
I'd be happy to come back to you on the very specific nature of that question to make sure that I've given you the appropriate response.
Okay, and I would also add to that I would like to hear if there's any alternative services that VAC provides those spouses for this unique military form of trauma. So it is concerning to me that we don't have that really clear. So I'm looking forward to hearing from that, because I think, you know, when we look at the reality that we are struggling to get women in the military, we're seeing women on the other side when they become veterans really struggling. We know that women after 10 years, we're seeing women veterans becoming more and more challenged, especially around homelessness. We know that veterans that are single are more often than not women. So I'm very concerned that they're not getting the supports that they need. So if you get that information back, I think if we want to attract women into the military, we better treat them well when they are veterans. Thank you.
We most certainly will, and I know, and I can certainly offer that through the Veterans Family Wellbeing Fund, we have been providing funding to a variety of organizations who are both conducting research and looking to develop this kinds of programming to be able to support the unique needs of women veterans in these kinds of circumstances as well.
Excellent. Sorry to step in. It's my job. I'm a professional interrupter. That concludes that brings us to the halfway mark of this meeting, and I want to thank both of you, or sorry, all three of you for joining us. I do want to ask Colonel Jardine to join us if the Colonel can turn her camera on. There she is. Excellent. If you are prepared, if you're ready, Colonel, the next 5 minutes are all yours for opening remarks.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Good afternoon, Mr. Chair.
Chers membres du comité, je vous remercie.
Thank you for this invitation to speak with you today. As you know, I was appointed to the Veterans Ombudsman position this past November, and this is my first appearance before you. I'm here with my colleague, Mr. Dwayne Shippers. I'm honored to share with you our latest study and report on mental health treatment benefits for family members of veterans.
The principle for our study is the understanding that when a military member serves, their family also serves. As a result, we believe that family members of veterans deserve access to funded mental health treatment when their own need is connected to military service. This is something that does not currently exist for those family members not participating in a veterans treatment plan. Cette question n'est pas nouvelle pour nous.
This issue is not new to us. It was in 2016 that we first made the recommendation to Veterans Affairs Canada that it provide family members with funding for mental health treatment in their own right, distinct from the needs of their veteran. In the fall-winter of 2019-2020, our office received a number of complaints around this issue. In February 2020, we launched an in-depth study in order to more fully substantiate our earlier recommendation.
On January 19, 2021, we found a growing body of Canadian research regarding the impact of service on families. Military families are known to be incredibly resilient, but the evidence speaks to the reality that military service carries with it unique stressors that can impact a spouse or child's mental health. Frequent postings, long and multiple absences of the military member, and the inherent risk of their illness, injury, or death are key factors in the mental health and well-being of military families. The Minister, in his response to our report, acknowledged the impact that military service has on the well-being of both veterans and their family members. Currently, the Department provides limited individual mental health treatment to spouses and children, but only when the family member's treatment is directly connected to achieving a positive outcome for the veteran. This policy ultimately has the effect of creating both inequity and a disservice to those veteran spouses and children who are essentially barred from accessing funded treatment in their own right simply because their veteran doesn't need or isn't in treatment. De notre point de vue de défenseur de l'équité,
from our perspective as an advocate for fairness, families who are experiencing mental health issues as a direct result of being part of a military family should have independent access to their own mental health treatment benefits. Let me share some of the stories that we were given permission to relate.
I'm not asking for charity. I'm asking to get the help I need, to support a man who has already given up too much in the service of his country. A disabled veteran shared with us that her young children essentially had to take care of her when she came home broken, and as a result, have mental health issues of their own. She related how her youngest daughter, who was under the age of 12, has become afraid of being alone, Her daughter needs treatment, but she simply cannot afford to pay for it. Another spouse shared about how her veteran spouse suffers from PTSD, which is made so much worse when his episodes cause severe distress to his children. They desperately need professional and age-appropriate treatment to help them make sense of their father's condition, and this is simply beyond her scope as a mother. The bottom line is that there is a gap in the way that the department is meeting its obligation to veterans' families. We have made 3 recommendations. First and foremost, that family members, including spouses, former spouses, survivors, and dependent children, have access to federal government-funded mental health treatment when the mental health illness is related to the conditions of military service experienced by the family member. This should be independent of the veteran's treatment plan and regardless of whether the veteran is engaging in treatment. Second, that the department conduct and publish the gender-based analysis of its policies and regulations for mental health support to veterans' families. And finally, that the department continue to demonstrate flexibility in meeting the individual mental health needs of family members. En résumé, nous croyons
In summary, we believe that this is an important fairness matter in need of both attention and action, and we are hopeful that in publishing our findings, we will see progress on this issue that recognizes the cost of service that some family members are paying. Your interest in keeping the conversation going is very important to me as the Veterans Ombudsman and to my office. Again, I thank you for your invitation to share our report with you.
Thank you so much, Colonel, for that incredibly heartfelt comments. We do very much appreciate you bringing your perspective to start us off on this study. Up first for questions for 6 minutes, we have MP Urdaga. Welcome, sir, joining us here today.
Sorry, I believe it's MP Doherty.
Okay, I apologize. Yep. My list in front of me says Urdaga, so I will absolutely give the floor over to MP Doherty.
Thank you, Chair. Colonel, I just want to say I appreciate your heartfelt comments. Since my first day being elected, I have been a tireless champion for those who serve our community and for those who serve our country. The passage of my bill, C-211, and our subsequent work has been both a blessing, but also a curse, I feel, because we have been inundated, our office has been inundated with messages such as yours. And so I really appreciate your testimony today. Colonel, in your opinion, should mental injury be seen in parity with physical injury?
Thank you very much for the question, Mr. Doherty. Absolutely. Injury is injury. I think we all understand that it doesn't matter whether it's physical or psychological. Our society has grown to understand that these injuries must be treated exactly the same way.
Your report was born out of, in part, the public backlash to the fact that a convicted killer, Christopher Garnier, who murdered an off-duty police officer, Catherine Campbell, received mental health services for PTSD that he claimed he got out of in murdering Catherine Campbell. Do you feel that convicted killers or Chris Garnier should have been receiving those benefits?
As the Veterans Ombudsman, it's not my place to speak about any particular case. What I would say is that what we're looking for and what we have pointed out in our report is that there's a gap for family members who have been, as part of a military family, have suffered some mental health issues and should have the right to access and the right to government-funded mental health treatment in their own right.
If a spouse is with a wife or a husband is with a veteran for over a significant portion of time and then leaves the marriage but still suffers from the mental abuse, the physical abuse that they endured for whatever reason, do you feel that they should be still be able to access Veterans Affairs mental health services?
This is exactly what we're saying, Mr. Doherty. And let me be clear, we're talking about mental health issues that come as a result of being part of a military family. The connection to service is the piece that we rest our report on. So if a spouse or partner has left the marriage or left the family unit, that has left her veteran or his veteran for whatever reason, and we've heard stories about abuse and that sort of thing, and the spouse feels compelled to leave, it perhaps takes the children with them, they are in fact at that point essentially cut off from access to Veterans Affairs and to any kind of support with respect to mental health.
Now, this recommendation has been, you say you first made it in 2016. Why do you think it's taken so long for the government to act on that implementation or that recommendation?
I think you'll have to address that question to Veterans Affairs. When we made our recommendation in 2016, that was actually as a result of the work we were doing on a study on around transition. And the recommendation we made was essentially informal. Over time and over the past 24 months or so is when we started to hear more complaints coming to our office, which is what led us to do our in-depth study.
Colonel, Mr. Chair, how much more time do I have?
You have approximately 2 minutes.
Perfect. Colonel, your third recommendation encourages Veterans Affairs Canada to continue demonstrating flexibility for the urgent mental health needs of family members and veterans. I agree with that. I think we should be doing everything in our power to reducing barriers for mental health services across the board, but we read in your report that very few families are accessing those services. Do you think that is because of the stigma or the ambiguity in terms of the legislation and policy?
I don't know about stigma or uncertainty. What I can say is that there is no program that exists for family members whose mental health needs are distinct from those of their veteran. At the moment, Veterans Affairs I should really say it's the professionals who are treating the veteran. If the veteran is in treatment for their mental health issues, if the professional who's providing that treatment determines that including their family members is to the benefit of the veteran, then the family members can be brought in for treatment as well. And that is great. And that is an excellent an excellent approach by the department. What we're saying with the gap is for those family members who are not part of the veterans treatment plan for whatever reason.
Colonel, in your opinion, is $3 million a year enough money to deal with mental health injuries, mental health challenges that our veterans and their families and their first responders, including our RCMP, are dealing with?
I'm afraid I can't really speak to the cost. My job as the Ombudsman is to shine a light on the gaps and the barriers. I think the department is better placed to answer questions with respect to cost.
Thank you very much, MP Doherty. My apologies for not having the order correct there. Thank you. Up next, we have MP Sampson.
Merci beaucoup, monsieur.
Thank you very much, Mr. Chair. And thank you, Colonel Jardine, for your testimony. Before I speak about your testimony, I'd like to congratulate you for your new position. I listened to your speech, and I see that this is something you're very passionate about. And when someone's passionate about their job, very good things ensue. So I congratulate you on your appointment to this position, and I hope that everything will go well in your position, and it's a very important one for veterans and their families.
Colonel Jardine, on mental health supports, of course, for families, I found certain things quite interesting. For example, I was impressed with the scope of your study, specifically around the impact of service to family well-being. We often talk, of course, of the effect of veterans' illness and injuries on a family, but you, in your report, included the impact of frequent relocation and the impact of frequent absent from families and the effect that this has, of course, on military families and children. So maybe you could help us and share some of the unique challenges and conditions that military service on families that should be considered as we're working through examining or looking at service delivery for caregivers. So keeping that in mind, maybe there's something you could bring to light here that would help us as we move forward.
Merci à Monsieur Sampson pour
Thank you, Mr. Sampson, for your very kind words, and thank you for the question.
that we did, and certainly as military families, the movement, the postings that we undergo every 2 to 3 years over a long career means uprooting one's family, to go all across the country, sometimes overseas. That breaks the bonds that children and families create in their societies, in their communities. It's fairly abrupt. Long absences of the military member. We go on training, we go on course. Pre-deployment training is particularly of long duration. And then when we deploy, and deployment itself is obviously for a long period of time, the risk of illness, injury, or death while you're deployed has a significant impact on the well-being of your family who's been left behind. Excuse me, I've only been retired for 2 years, and all of this is still very fresh for me, and I apologize for my emotion here. It does mean a lot to me. Perhaps I could ask my colleague, Mr. Shippers, who oversaw the report, the completion of the report, could perhaps add a little bit more.
Thank you, Colonel Jardine. The work that we looked at, and we looked at studies done by other organizations, but in particular the Canadian Pediatric Society noted the impact on children in particular of in terms of increased behavioral disorders significantly in that 3 to 8 years range, increased by 19%. Stress disorders increased by 18%. And although military families, as Colonel Jardine said, are resilient, but approximately 10% of them struggles with the challenges directly related to military service. So the moves, the frequent moves, the deployments, the postings, and the risk of death, particularly the risk of injury and death, and it increases when we're in an active combat type environment where they're seeing stuff on the news and they're concerned about their family member. Of particular concern, I think, is the adolescent military dependents are far more likely to have admissions for injury, suicide attempts, and mental health diagnosis than non-military teens.
Thank you, both of you, for that answer. And I have a number of uncles and cousins and whatnot that had to move on many occasions, and the spouse who would have a good job and then had to, of course, try to find a new job while relocating, and some of the challenges. We've made brought some benefits and supports to families in that transition. Are you able to speak about that somewhat?
There are supports, and I believe things are improving. But I would ask, I think it's probably better if the department speaks to those in particular. It's outside the scope of the work that we are doing at the moment for me to speak about that in specific, unless Mr. Shippers, you could add something there.
Or maybe in some of the gaps you've identified, maybe would there be some improvement suggestions you could make that we could look at to make that transition even easier on families? Maybe you could share some of that.
About 30 seconds, please.
Yes, thank you. Those studies that we undertake as the Veterans Ombudsman, I believe a study was done in the past. I'm not familiar with it, having just been in the job for 2 months, but perhaps I could have my team send that to you in writing afterwards.
Thank you.
Thank you. And now over to Député Desilets for 6 minutes, please.
Merci, Monsieur le
Thank you, Mr. Chair. Hello, Ms. Jardine, and congratulations for your appointment to this position. And I know that you'll be good in this role. I have a question for you. I don't know if you'll be able to answer. Your predecessor had written in a report that the biggest problem around accessing services at VAC is a problem of information and transparency on the department's behalf. What did he mean exactly? I don't know exactly what he wrote, but I can tell you about the perspective that I am familiar with and what I have come to understand over the last 3 months since I've been in this position. Often, we receive complaints from veterans or their family members that
good. Okay. But it's hard for them sometimes to understand exactly what are the benefits that are available. I'm learning. What are the benefits that are available? How do they access them? This is, in fact, one of the complaints that we receive at the Ombudsman's office, and we do our best to help them untangle their way through all of the information or lack of information or difficulty in understanding the information. Absolutely.
Okay, donc.
All right. So would it be accurate if we said that the department's efficiency would increase a lot if there was more information and more transparency, in your opinion? After only 2 months of reading. That's right.
From our point of view, from the Ombudsman's point of view, anything that can be done to improve the clarity of information, the simplicity of information that is provided by the department to the veterans and their families would be most welcome.
But notre question.
Another question. Now we know that there's a huge impact on the family when there are mental health issues. We understand that for families, the meetings are limited to 20. 20 sessions are currently allowed. That's less than there were before. What do you think about that? Should this be increased? And how was that number 20 calculated? Thank you very much for that question, Mr. Desiree.
What we are saying in our report is with respect to the family members who don't have any access at all. The sessions that you're referring to and the exact number, I would ask the department to préciser, is all related to treatment that is part of the veterans treatment plan. What we're saying is the Ombudsman and the gap that we are trying to shine a light on for these family members who don't have access in their own right when their treatment isn't connected to the veteran at all, but it's connected to their service. By being part of a military family, they experience all of those stressors that we spoke about just a few minutes ago, and that has an impact on them. And if their veteran isn't in treatment, then they have no access. How that access is done is up to the department to determine, but it is. But what we're saying is that this gap needs to be filled.
Okay. J'ai du temps encore.
All right. Do I still have time left, Mr. Chair? 2 minutes. There's always 2 minutes left with you. That's great. Your second recommendation said that the department should publish a gender-based analysis of its policies and regulations where support is concerned. Well, along with my colleagues, I would say that I'm completely in agreement with that. I would like to hear from you. In your opinion, what is that request based on?
based on the fact that we asked for their gender-based analysis report, to have a copy of it so that we could understand what they had done with respect to mental health supports for families in their own right. We did not receive that report, and therefore we put it in our recommendations. We don't know whether or how it was conducted, and we would ask to see the publication of their analysis in this area.
Okay. Merci,
Thank you very much, Madam Jardine.
Thank you. And now over to MP Blaney for 6 minutes, please.
Well, welcome, Colonel Jardine. I'm so happy to have you here today, and congratulations on this position. It is very good to see a woman in this seat. I'm very excited about that. First of all, thank you for this report. I thought it was very thoughtful. One of the recommendations, the first one, you talked about there should be an independent, the treatment plan should be independent of the veterans treatment plan. We know that a lot of family members, you talked about children, partners are falling through the cracks. And of course, a veteran is not going to do well if the people surrounding the veteran are really struggling because of their service. So I'm just wondering if you could talk about what that might look like and why you think it's so important that it be independent of the veterans treatment plan.
Ms. Blaney, thank you for your kind words and thank you for your question. It is so important because military service affects the families as well. If we accept that when a military member serves, their family has also served. If we accept that, and we accept that therefore the family should also receive care for their part and what they've contributed to their country alongside their military member, then that is the reason why that if they've suffered some mental health illness or issues as a result of that service, how would that look? That would be them receiving, the same level, same kind of funding from Veterans Affairs in recognition that their mental health issues are related to their service as well, and that it is not necessary to be connected as part of their veterans treatment plan. It's a very simple gap to fill from our perspective. If the family has served, if the military member has served, the family has served, and if there are mental health issues, then let's meet that obligation to the family.
Thank you. I couldn't agree more. You did mention, of course, and I appreciate another member already asked this question about the importance of the department conducting and publishing a gender-based analysis of its policies. And I know you didn't speak to this specifically in your report, but I'm just wondering if there would be interest in the future, because I know that one of the challenges is for single veterans, the majority of single veterans are actually women. And so when we talk about their support and their caregiver support, really until this work is done and it's public, we won't be able to see clearly what those gaps are. And I know that the previous ombudsperson was really focused on making sure that we start talking more about women veterans. And I'm just wondering if you could speak to why this report is so important to share with the public, the GB or GSA plus, but also if I know you're just figured 2 months, you keep saying that, and I really respect that. But in terms of you setting your own priorities, do you see women veterans as something that you may be looking into? Because this is just a growing gap that I'm seeing.
Again, thank you for that question. Absolutely, unqualifiedly. We are in the middle of doing our strategic planning to set what our priorities are going to be as we go forward into my mandate. And part of the outcome of that is to exactly determine where are we going to put our investigative capacity, into what areas are we going to look. And I can assure you that women veterans will absolutely be part of that.
Thank you. And I hope that you will see fit to look at the caregiver supports that are out there and how veterans that are women that are single get those supports and that they're accessible, because I think we all share in this committee, and of course in your position, we just don't want to see veterans alone suffering without any support and without resources to have that support. I guess my, hopefully not my last question, but we'll see. You talked about the department needs to continue to demonstrate flexibility in meeting the individual mental health needs of family members. And I'm just wondering, like, what does demonstrate flexibility? You know, one of the things that we're always challenged with whenever we're dealing with people is how do we make sure there's consistency but enough flexibility to serve people where they're at. So I'm just wondering if you could speak to that and what you heard in your report.
Thank you. This recommendation speaks directly to the regulatory legislative framework within mental health support, within which the department delivers mental health support to families. I would like to ask my colleague, Mr. Shippers, to respond to you. He's, as our legal counsel, he's probably got a better set of words to explain it more clearly.
Thank you.
Thanks, Ms. Blaney. I mean, in the simplest form, that recommendation is intended to encourage VAC to color as close to the line as possible when making determinations. And sometimes if you color a little outside the lines, it's okay if the person gets the help that they need. And so that's what that recommendation is intended to do. And I think we'd recognize that within the existing legislative and regulatory framework, VAC is trying to do that, particularly with the changes that that by rolling back the policy and putting the new one into the new guideline into effect in May. They've moved more in that direction. But it really requires legislative and regulatory attention to make sure that family members get this access, independent access to mental health treatment for service-related illness. And it requires that kind of clarity, because there isn't that kind of, most of the benefits are really linked to the veteran and not linked to the individual family member under existing legislation and regulations.
Thank you very much. Sorry, I got to cut that off there. Now for 5 minutes, MP Broussard, please.
Thank you, Mr. Chair, and thank you, Colonel, for being here with us today. And it's nice to meet you. And frankly, I'm going to just make a statement more so than ask a question. I'm going to be passing some of my time off to Ms. Wagenthal. I've been watching your testimony, been listening to you very, very closely, and I can't imagine a more difficult situation to walk into than the study that you did. And I will say this, it's in my opinion that the government made absolutely the right decision in hiring you. And I'll tell you why. It's not because you're from Alliston originally, which is just 20 minutes down the road, but you're showing a level of empathy and compassion that is precisely needed in order to deal with the magnitude of the situations that you're going to be dealing with veterans and their families. And I can tell you, you said earlier on that you apologize for getting emotional. Never apologize for getting emotional. I can't begin to tell you how many times I've sat in this office crying with veterans, veterans who have thought about committing suicide because they're not getting access to the types of services that they need. We've all shed tears, and never apologize for that. And I just want you to know that I give you the same advice as I give my colleague Todd Doherty. Make sure you take care of yourself first. Know that we are here as a committee to help you. I am here as a member of Parliament to help you, because at the end of the day, it's all about helping veterans and their families. Kathy?
Thank you, John. And I just wanted to echo that. Thank you, Colonel Jardine, for your service, for your transparency, your personal transparency. You're going to do a wonderful job here. And for the stories, life stories that you shared today in regards to caregivers, as John said, it is overwhelming at times. And I want to just ask you a question in regards to what I'm hearing is there are gaps, inconsistencies, there's backlogs, subjectivity in decisions that are made, because I really think a lot of times everything's too complicated and definitions aren't clear. And so we hear often about the dynamics around sanctuary trauma. And when I met with the Caregivers Brigade, excuse me, they used the term, the war at home. And I just would like you to comment on that. That just describes to me the very issues that somehow are being missed in dealing with the needs for caregivers, spouses, and children.
Mr. Brassard, Ms. Wagenthal, thank you for your kind words, and thank you for thank you for your kind words. I think you're absolutely right, and this is the point that we're trying to make, that the people who are the first responders to veterans are their families, and military service takes a toll on both of them, the veteran and their family. And we believe with this report and this study that we've done, that we've demonstrated very clearly that this gap exists. There is work to be done to fill that gap. It requires some commitment to do that. And if we agree, and I can't state this more plainly, if we agree that the family serves while the veteran serves or the military member serves, then, and if we say that we're going to take care of the veteran when they become ill or injured, then how can we not extend that to their families and do it in a way that recognizes, who they are? They're not just part of the furniture and effects. They are individuals, children who grow up, who need to grow up and who sometimes need help in order to make that transition into adulthood successfully, to become citizens of our country. These are things, this is the part that is heartbreaking to those of us who understand this. It's heartbreaking to hear these stories, as you could tell, and we would urge the government to please take the steps necessary to fill this gap.
You have about 1 minute, Kathy.
Oh my goodness, I didn't expect that. Thank you. I never have an extra minute left. Oh my goodness. Well, I just want to say that I'm looking forward to the opportunity to work further with you, as John has mentioned, and this entire committee. We want to make a difference for veterans and their families. So I'll just say thank you again for the privilege of being able to interact with you today, and look forward to more of the same. Thank you.
The privilege is mine.
Thank you. MP Lalonde for 5 minutes, please.
Merci beaucoup.
Thank you very much. First off, as my colleagues did, I'd like to congratulate you, Colonel Jardine. I congratulate you for your new role in this appointment.
From the statement and recommendations, I look forward in hope of seeing more of this great work that you've done. I also noticed from your statement that some of the stories are largely from the perspective of female caregivers who are calling on increased support and certainly more agency to request it. I guess my question would be at this point, are the caregivers who request assistance from your office predominantly female? And how is their experience of female primary caregivers different from the experience of male caregivers?
Merci, Ms. Lalonde, and thank you.
Thank you, Madam Lalonde.
There are two things in your question. Our report didn't focus on caregivers because we're focused on family members in their own right, not in terms of their ability to be a caregiver to their veteran, but to seek and to be given access or given funded treatment in their own right based on their own mental health issues. At the same time, though, I can tell you that we are working, one of our upcoming investigations, actually it's underway, is on the question of caregivers. And I will ask my colleague, Mr. Shippers, to speak to that because I haven't I just haven't been briefed on it up to this point.
Thank you, Colonel Jardine. And I just say that some of the work we've done in terms of the impact of transition on our transition, we did a qualitative study about 2 years ago on transition that showed that the family, and particularly the spouses, are the most important factor in a successful transition of a military member from military life to the civilian life. We're going to be looking at the caregiver recognition benefit. We started to look at it, and we'll be looking at things such as access, the qualifications for access. It seems, and it shouldn't be any shock given the percentage of male Canadian Forces members versus female, but the largest proportion of caregivers tends to be female. But we'll be looking at this through a GBA plus lens as well, looking at how it impacts single female veterans, looking at who the caregivers are, who the family members are. Is that different in different forms? For example, is the Indigenous definition of family, is it broader? How are Indigenous veterans and their caregivers impacted? So we'll be looking at the impact, we're looking at the needs of the veterans. And we'll also be looking at the quantity of the benefit. Is the caregiver recognition benefit really sufficient? Is it really compensation, or is it token recognition while the care is foisted onto the partners or the caregivers' responsibility as opposed to the government? So we'll be looking at those things, and we look forward to talking to the committee about that once we've completed that work. And I think MP Blaney had asked about MST earlier, and we're also looking at access to counseling, individual counseling for military sexual trauma, survivors of military sexual trauma, and what resources are there and being provided to veterans.
Thank you. I have a minute left, and I know that you told a story of a woman veteran who became disabled in her service and is now being cared by her young children. How common is a circumstances like this where the veterans may need care but may not be receiving it from a mature caregiver?
That's an excellent question. I'm not certain that I would have those sorts of statistics at hand. I think it would probably be related to the incidence of, how many military members or veterans are single or single parents, and then, what's the circle of support that they have around them. Perhaps, Mr. Shippers, you might have discovered more during the conduct of the study.
Very briefly, please, because it's time.
Yeah, I would just say that we didn't look well. What I would say is that the complaints we get represent a small fraction of what we think is out there. For a veteran, they have to come to us after they've gone through an initial decision at VAC, an appeal at VAC, a second appeal at VAC, and then if they have any fight left in them, they come and see us to help them. And so what we see is just a small, the top of the iceberg of what we think is really the situation.
Thank you very much.
Thank you. And up next for 2.5 minutes, Deputy Desilets.
MP Desilets. Thank you, Mr. Chair. Ms. Jardine, mental health, of course, is one of the many sectors of health. And I'd like to hear you talk about one thing. We're asking for the federal government to give the province higher transfers. In your opinion, is that justified? And could that help our veterans in some way?
Of your question, Mr. Desilets, are you talking about the federal provincial transfers with respect to health?
Oui, exactement.
Yes, that's exactly right. This is for money that would be sent to the provinces because health care falls under the province's jurisdiction. Do you think this could be something that would help so that we could create new projects that would that would help our veterans?
What I can do as the ombudsman is simply point out where we see the gaps. I would we leave it to the department and to the government to determine how to do those things, how to fill those gaps, how to cost those gaps, and then to determine how those things are going to be met. I'm afraid my remit is only to point out and shine a light on the gaps and barriers.
Je vous comprends.
I understand. In terms of the backlogs and the things that are behind schedule, this has an important impact on veterans' family members. Are you familiar with this matter, and what do you think about it?
And the wait times, as you on the committee very well know, we've read your report, and thank you for all the recommendations that you made. Delays in approving disability claims for veterans have an impact not only on the veteran and their health, but also, as we can well understand, on the health of their family, both physically and in terms of their mental health. So that wait time question is certainly a very serious one and is one that we continue as the Ombudsman to watch closely.
Thank you very much. Thank you. Now, for 2.5 minutes, MP Blaney, please.
Well, thank you. It's wonderful to get to ask a few more questions. I'm just wondering, Colonel Jardine, if during the report, if you heard from common law partners of veterans and their access to or lack of access to supports for themselves as they were the caregiver or are the caregiver to the veteran.
My understanding of the definition of family, and Mr. Shippers will correct me if I'm wrong, I'm sure, but when a common law relationship is recognized in law, then it is recognized by the government and obviously by the department. So I think in the research that we did, we didn't find any difference for between being a married spouse or a common law spouse. A spouse is a spouse under law.
Perfect, thank you. And I thank you so much for also mentioning the military sexual trauma, the MST. I'm just wondering, you know, this is something that concerns me greatly because the impact not only on the veteran, but on the family can be significant. And I am concerned that there are challenges with VAC for military sexual trauma versus other service-related injuries and illnesses. I'm just wondering if that's an area that your office might be looking into in the future. It sounds like you are, but I'd love to hear some more.
As I mentioned earlier, we are looking at where we're going to put our investigative capacity over the next 2 years or so. And we're going to prioritize that because, of course, we are limited in the resources that we have. We have investigations underway. Certainly from my point of view and understanding that the team and I have yet to work our way through this, I can see women veterans with respect to all the intersectionalities that affect women veterans, as well, including military sexual trauma, not only for women, but for men as well.
Yes, I was going to say that. Thank you so much for saying
that. Yes, absolutely. The number of intersectionalities, and certainly we put everything we do through a gender-based analysis, as Mr. Shippers pointed out, and we look to pull out all of those intersectionalities and look to find the gaps and the barriers in the programs and benefits that VAC is providing.
Thank you. Thank you so much. And I want to thank the witnesses, all the witnesses. That brings us to a close today. Thank you very much, Colonel Jardine and Mr. Shippers for kicking us off in the right direction with this study. Very much appreciate your time, patience, because we got going a little bit late today, and also flexibility for being able to meet at a later time. Thank you to all my colleagues. Thank you to everyone in Ottawa that makes this possible. all the technical folks, interpretation and or translation, excuse me, and of course the clerks and analysts. That's a wrap, folks. I adjourn today's meeting. Thank you.
Thank you.